Hey everyone, today's video is on my setup for a crown prep here. This is just kind of how I lay my room out, and I'll also be going over the order of how I do things from the role of a dental assistant. So on the doctor's side, I like to keep a instrument pack as just about everything you might need for doing a filling. Essentially, you got the burnisher, the plastic instrument, basic mirror, comp pliers, all that good stuff. Nothing crazy. Burr block, got a football, a coarse straight diamond, mostly diamonds here, and a couple of carbides if you can see them in the back, some polishing cups. That's our burr block, our operative burr block. Nothing crazy, same thing. Slow and high speed handpiece. So this is everything I keep on the doctor's side. Some people will add cotton rolls and stuff for floss, bite paper, or whatever. I like to keep mostly everything on my side. Some people will also keep the instruments on their side. My doctors prefer to have it here, so that's where I keep it. Air and water tip, always essential. Got your suction setup off over here. I like to cover it just to cover it, basically. And coming to the back side here, I got my little scanner tote. We use the Trios 4 at this office, so this is what we use for the final impression. But first thing I do when I get in the room, consent, and then I get the patient dressed. So bib, glasses, eye protection is very important. Then we'll do consent form, take blood pressure is next, and then I'll start my scan. So I'll do a pre-scan with the Trios, get it started, so upper, lower bite. Then I'll move over to taking my stent. So we like to use heavy body PVS for that, and a triple tray. So you got either the anterior or the posterior, whatever you're working on. Then I'll take my shade. You got your shade guide, very important. Now we're ready to numb, so we're going to do our topical anesthetic Q-tip. Got your topical, little 2x2, some cotton rolls, and then you also want to have your syringe, aspirating syringe with some local anesthetic. We like to use articaine at my office, or septicaine. So you have your local anesthetic. I always have both needles out, just because if I don't use one, I'll set it aside. That's the way I like to set up. Now we do have a buildup planned for this case. So we've got some etch, bond, some buildup. This is the buildup we like to use, but any buildup will do for your setup. I do like having the intraoral tip though. Makes it a lot easier to do the actual buildup. Micro brushes, essential. Once you're finished up with your prep and buildup, we don't pack hoard here. We just use the astringent paste. This stuff works really well if you're gonna be trying to manage some bleeding as well. You got your retraction cap, so it really gets down under the gum. Then once you're done with your scan, make your temp. So this is a temp material we use, the maxitemp. I think this is A1. Yeah, A1. You got your tip. If you're a new dental assistant, I'd also suggest having extra tips for both this and this, just because we mess up when we're new. I like to have some bite paper, floss, check the contact, check occlusion, adjust with the handpiece. I've also seen people use lab handpieces before. Those work well. I prefer the high speed. I don't like opening a whole new package. Once my temp is made, tried in, contacts and occlusion are good, you go to your temp cement. This is the temp cement that I like to use. I find you get a lot less temps coming off with this stuff. I'm very confident sending a patient on vacation with a couple of temps with this cement. This stuff is really, really strong. And some PPE for me. Then just a random hemostat there, not relevant to today's prep, but it's there. So that is the whole setup here. I got everything, and yeah, that is today's video. If you guys want to leave a comment or subscribe, feel free. And if you want to see a specific video or setup, let me know, please. And that'll do it.